Hello everyone. Today we are going to discuss a brief about anemia and its morphological classification, normal concentration of hemoglobin and RBC count for the different age group. So, what is anemia? Anemia is derived from a Greek word anemia, which is made up of N and Haima. N mean without and Haima meaning without blood. So anemia is a condition without blood. So what is the definition of anemia? The definition of anemia is deficiency in the number or quality of RBCs or hemoglobin in the blood. So deficiency in number or quality of RBCs or hemoglobin in the blood is known as anemia. What are the common clinical features noted in anemia? A patient complains of fatigue, weakness, shortness of breath, and skin pallor. So these are the common clinical features seen in anemia. Now we'll see the normal ranges of hemoglobin and RBC count for different age group. Normal ranges: hemoglobin in gram per deciliter, RBC in cells, million cells per cubic mm or microliter. So in adult male, normal hemoglobin range is from 13 to 17 milligram per deciliter, and the normal RBC count is between 4.5 to 5.5 million cells per cubic mm. In adult female, normal hemoglobin concentration is 12 to 16 gram per deciliter, and RBC count is 4 to 5 million cells per cubic mm. And in pregnant female, normal range of hemoglobin is 11 to 15 milligram per deciliter, because the plasma volume is increased during the time of pregnancy. And in neonates, normal hemoglobin concentration is between 14 to 22 gram per deciliter, and RBC count is between 4.8 to 6.8 million cells per cubic mm. And in children, normal hemoglobin concentration varies from 11 to 16 gram per deciliter, and RBC count between 4 to 5.5 million cells per cubic mm. So anything below the lower normal limit of the hemoglobin concentration or RBC count comes under the anemia. As the definition say, decrease in number or quality of RBC or hemoglobin in the blood is known as anemia. Now we'll classify anemia on the basis of etiology or morphologies. So in this lecture we will cover the classification of anemia on the basis of the morphology. Classification of anemia on the basis of the morphology, that is based on MCV. MCV is mean cell volume, that's the mean RBC volume. Normal range of MCV is 80 to 100 femtoliter, and we will discuss later on how we calculate MCV, MCH, MCSC. These are the absolute values or RBC indices. We'll discuss in separate lecture. So if MCV is below 80 femtoliter is known as microcytic hypochromic anemia. If MCV is between 80 to 100 femtoliter, the condition is known as normocytic hypochromic or normochromic anemia. And if the MCV is more than 100 femtoliter, the condition is known as macrocytic anemia. So now we'll discuss about the common examples under all these three categories. In microcytic anemia, we have sideroblastic anemia. We will discuss all the anemia in detail later on. Iron deficiency anemia, thalassemia, anemia of chronic disease. In anemia of chronic disease, there can be microcytic picture, normocytic or macrocytic. All three picture can be seen in anemia of chronic disease. In macrocytic anemia, there is a mnemonic used for the examples of macrocytic anemia: Lady Harding Medical College. L for the liver diseases in alcoholism, H for the hypothyroidism, M for megaloblastic anemia seen in vitamin B12 and folate deficiency, C for cytotoxic drugs. Now we'll see the normocytic anemia. To classify normocytic, normochromic or hypochromic anemia, we perform reticulocyte count, which is increased in hemolytic picture or hemolytic anemias. We will separately discuss about the hemolytic anemia or classification of hemolytic anemia, how we approach hemolytic anemia. If the reticulocyte count is normal or low, there can be several possibilities for this condition. One of them is renal disease, anemia of chronic disease, myelofibrosis, and malignancy that involve the bone marrow, any metastasis, lymphoma. So this is it for this lecture. In the next lecture we will cover about the hemolytic anemia. Thank you.